Welcome to Examining Social Networks in Workplace Safety and Health, Why and How. We're glad you're here. My name is Angie Hunt, Project Manager with the Work Wellness and Disability Prevention Institute, and I'll be moderating the webinar today. This webinar is made possible through the support of the Community Gaming Grant Program through the BC government, as well as donations and memberships to WWDPI. We thank our program partners, Canadian Council on Rehabilitation and Work, our Education Advisory Committee, and speakers who contribute to this webinar series. We're waiting for others to join us. I'll go over a few technical points for the webinar. You should be able to hear the presentation through your computer speakers or through the conference call line if you dialed in. Please use the question box to submit any issues you may be experiencing and to ask any questions you have related to the presentation. We'll collect questions submitted throughout the presentation and follow the presentation with the Q&A based on the questions submitted. Following the webinar, any questions not answered in the allotted time will be answered and distributed after the event. The presentation will be recorded and posted for free on our website within a week along with the slides. You'll be emailed the direct links for all these items when they are available. As I mentioned, my name is Angie and I'll be moderating the webinar and Q&A session. Our presenter today is Jessica Streit. Jessica Streit is a research psychologist with the U.S. National Institute for Occupational Safety and Health and assistant coordinator of NIOSH's Healthy Work Design and Wellbeing program. She is a recipient of the NIOSH Director's Award for Extraordinary Intramural Science in the Early Career Scientist category, and her research interests include social networks and health, psychological detachment and work recovery, and advancing the use of theory as a blueprint for occupational health research and practice. Jessica earned her master's in industrial organization psychology from Northern Kentucky University in 2007 and is now in the last year of her doctoral candidacy in health education at the University of Cincinnati. Her dissertation research applies the expanded stressor detachment model as a framework for investigating pathways to enhance professional engagement and health for early career teachers. And now I'll hand it over to Jessica.
Hi, I just wanted to do a quick check and make sure you can hear me okay.
Yes, we can.
Perfect, thanks. All right, well, thank you, everyone. Hello, and thank you for attending today's webinar. I'm really excited that the Work Wellness and Disability Prevention Institute has asked me to provide you with some information on the importance of social network methods and approaches to occupational safety and health research. Something I've become pretty passionate about in the last 18 months or so, and I see being a very big part of my portfolio moving forward, and I hope others will be joining me as well. This webinar may be a little different topically than others that you've viewed before from the Effective Workplace series. So rather than discuss recommended solutions, we'll be talking about a method that you can use to gather data and a method that can really help you in research and in practice. And that method is called social network research or social network science. So the webinar will be divided into two main sections. In the first, we'll cover some of the fundamentals of social network science. That will include reviewing basic terms, discussing methods for collecting social network data, hitting on some common uses for that social network data, and then talking about processes and programs available to analyze that data that you would be collecting through your social network approach. And in the second section, then we'll take a walk through some examples of social network studies. So I'll highlight some relevant publications in the scientific literature, and then also tell you about some activities that I currently have underway with colleagues from local universities. So to start the discussion today, I have a few questions for you about the people in your lives. I'll read through the questions, and I encourage you to really think about what your answers would look like as we go along. Who have you seen since waking up this morning? Who have you called, texted, or emailed today? Who are your favorite coworkers? And who are your closest friends? And who do you usually talk to about important matters? So when you answered those questions, were your answers all the same, or did different names really come to mind for each prompt? I'm imagining that for most of us, there was probably at least some variety in the responses, and that's completely normal because people play different roles in our lives. And because we're humans with an inherent need to make sense of or find order in our lives, we really classify those different roles that people play in our life using relational labels. So we assign labels not only to the people that we know, but also to those that we don't necessarily know, but who become part of the backdrop of our lives. So we can really classify the people we interact with on a regular basis and feel closest to into groups like family, friends, or coworkers or colleagues. And beyond that sort of closest, most intimate circle, then we have the people that we know through shared affiliations, like maybe work or school. And these are the people that we typically call our acquaintances. And then we have the people that we see on a regular or routine basis who don't necessarily feel like they fit into that acquaintance category. These might be people that we see daily, or there might be longer periods of time between our interactions with them. A lot of our service providers will fit into this category. So people like dentists, doctors or physicians, hairstylists, counselors, or maybe even people who are responsible for your transportation modes like bus drivers. So we have a history of connections or interactions with these people, but we don't necessarily feel close or even friendly with them. Then beyond that, and less familiar to us, we have those one-off contacts who we see irregularly or who we may never see again. So people in this category might include people like wait staff at a local restaurant, employees who help us make a purchase at a retail outlet, or employees in the emergency room in case of a medical event. And then finally, we cross paths with people and may never directly interact with them at all. So examples of people who fit into this group of quote unquote strangers would be other people who are walking around a park or shopping center when we're there, or other drivers who are on the road when we're going from point A to point B in our own life. So when we do have a need to connect with other people, there are a number of mechanisms and platforms from which we can choose. So most directly, we can be in that exact same physical space and have an opportunity to talk with people face to face. But if we can't be in the same physical space, then we can use delivery services like the Postal Service, FedEx, DHL, the United Parcel Service, and others to send goods or information. Or, and perhaps most commonly today, we can interface with others through technological outlets. So this could include things like phone calls, text messages, emails, and other social media platforms and applications. So when you start to think about it, we've got a variety of categories for the people in our lives, and then a variety of categories for the communication or interaction platforms that we can use to make connections. And it becomes a lot to try to understand and can feel really challenging when we're trying to figure out how to make sense of all of the information about how people interact and how they're interconnected. Now, generally speaking, we turn to research when we want to try to understand something. And when I'm saying research here, I don't necessarily only mean formal, structured scientific studies. Those are definitely part of the research domain and a very large part at that. But our informal efforts to gather information from other people will count as well. So formal and informal research in the social sciences, where we want to understand people to some degree, rely on traditional methods to gather information. And in those traditional approaches, we're asking specific questions to specific people. So we use surveys, interviews, observations, or other data collection methods to gather information at the individual level about each person's traits, beliefs, attitudes, opinions, knowledge, or behaviors. And that's good, but it limits our investigation to individual level characteristics. Now, those are useful, but the problem is that those types of studies limit our investigation because human beings don't live and work in a vacuum. So people are social beings, and our social connectedness means that other people influence many of the things we're typically interested in studying in the social sciences. So when we gather data only at that individual level, it leaves a lot of gaps in our understanding about how social connectivity can affect personal traits, beliefs, attitudes, opinions, knowledge, what else? Decisions, choices, and even behaviors. And from a health perspective, our overall well-being. So that can be especially limiting when we're investigating things like potential best practices to help people with chronic pain or disabilities successfully stay at work or return to work, as I suspect many of our audience members may be doing given WWDPI's mission. But we can start to fill those gaps in our understanding about interpersonal influence by adding social network research to our efforts. So social network science is a set of methods that's designed to really tackle and help us make sense of this idea of interpersonal connectedness and the impact that it can have on our lives. By definition, social networks are systems that are comprised of the connections that are shared between people, groups, or organizations, or really any other unit of interest that we're interested in investigating. So for the sake of this presentation, I'm going to focus on the personal level networks. So those are the ones that are comprised of people that we know and spend time with. And studying those person level networks allows us to explore, understand, and account for the relationships that we have with other people and how those relationships affect us. So to help us talk about those networks in a meaningful way, we really have to start by reviewing some of the most common terms that are used in social network science. The most basic elements that we need to build a study about networks are the actors or the nodes. Every actor represents a single member in the network, and we usually talk about actors when we're talking about people, and we would use the term node if we were talking about some other unit of interest. So this webinar is an example of a mechanism that's generated a new network of actors. So as the presenter for today's webinar, I'm an actor in the network. As the moderator, Angie is an actor in the network. And then every audience member is also an actor in this new webinar-based network. Actors in a network are connected to one another through paths. These are also sometimes called ties, which is a term I prefer. The ties between actors can be unidirectional, where the information exchange or behavior exchange is going one way, or they can be bidirectional, where there's a two-way flow between the people. So this lecture portion of the webinar is one example of a unidirectional tie. I'm sending the information out and you're receiving it. But when we get to the Q&A portion of the webinar, the ties will become bidirectional for people who ask questions or make comments. So I'll be sending information out, they'll send information back, I may send information out again. It becomes very conversational. So now we've got a two-way flow. So every tie, whether unidirectional or bidirectional, connects a dyad or pair of actors in the network. And then the entire network is the group of dyads that meets a particular set of established criteria. So those criteria can be event-based, like this webinar, or they could be affiliation-based, like working for the same organization. So there's many ways we can put boundaries or parameters on a network, just like there are many ways that we can define a population of interest if we're doing something with a more traditional approach. So regardless of how bound a network, it will contain a few basic types of connections between the dyads. So we've already talked about how connections can be unidirectional or bidirectional, but then there are some other ways that we can describe those connections. So for unidirectional connections, flow is important. The connections can be outbound. So outbound connections are those that we identify or name as our connections if we're asked questions about the people in our lives. So the three connections that I've highlighted in this fictional network here on the slide all lead to outbound ties for that person in the top row wearing the black jacket in that third from left position. As a real world example, if I were asked who I talk to when I need help making a decision about some aspect of my health, 4 people who immediately come to mind for me would be my husband, my sister, my mom, and then a friend that I've had for just a little over 2 decades. So I would have an arrow going out from me to each of them if you were to diagram that network. But then unidirectional connections can also be inbound. So our inbound connections are the people who name us as a connection when they're asked questions about their networks. So in this fictional network here on the slide, that person in the bottom row in the yellow dress, you can see has 3 inbound connections. 2 come from the top row, and then the third comes from that same row in the bottom to her right. In my real world example, if you ask my longtime friend Anna who she talks to when she needs help making health-based decisions, she would be an inbound connection to me if she named me as someone that she goes to. Or if I was asked who comes to me and I name Anna, then she's also an inbound connection to me. So outbound connections are really the people we go to for something or who provide us with something. And then inbound connections are the people who come to us for something or the people to whom we provide something. Connections between actors can become bidirectional when actors name one another in response to a question. So the 2 actors become connected to one another, both inbound and outbound, or to and from. So Anna and I would be connected bidirectionally if we both named one another as someone we go to in making health-based decisions. In this fictitious network example on the slides, each of the three paths that I've highlighted toward the left in red represents a bidirectional connection. And together, these three actors who are connected here form a clique or a subset within the overall network, where every person in that subset has named one another in response to the questions they've been asked. So a large network can have many cliques within it. And we can think of these really as sort of the social circles that are embedded within larger networks. Gatekeepers are actors who have relatively many inbound and outbound connections compared to the other network members. So if you think about how information might flow through a network, gatekeepers are those people who would be considered central hubs. They're also frequently considered role models or influencers when it comes to behaviors, attitudes, or decision making. Gatekeepers serve an important role in the network because they not only send information out, but they can also bridge or connect to people or cliques who might otherwise not be connected to one another. So in this fictitious network on the slide, you can see this individual in the second row who has this mauve colored top and blue jeans on. She has considerably more connections coming into and going out than other people in the network do. She would be a gatekeeper in this network. Conversely, networks can also contain isolates. So these would be actors who have no connections coming in or going out. So in this fictitious network, the individual I've circled in the top left corner has no inbound or outbound connections and therefore would be an isolate in this network. Isolates tend to exist on the periphery of a network of people and have very little influence over what's happening in the network. But on the flip side of that, that can also mean that the network is having very little influence on things like the attitudes, beliefs, behaviors, or decision-making processes for the isolate as well. So to now, we've kind of talked about things like attitudes, beliefs, or decisions as reasons that people might want to look at how people in a network are connected to one another. But there are a lot of contexts within which these social dyads or actor-to-actor connections exist. Some common examples of phenomena that we might want to explore using dyadic relationships include co-occurrences of things like being members or participants in the same groups or organizations, being in the same space at the same time, or sharing similar individual level traits or attributes. We might also want to look at social relationships like family ties, whether or not people have similar likes or dislikes, or whether or not they know the same people. We might want to look at interactions between people, so what do they do together? Or we might want to look at how things like information, goods, or even health conditions flow between and within a group of people. So now that we kind of have a basic understanding of how people can be connected to one another, we'll review some of the most common network metrics that we can obtain by studying those dyadic actor-to-actor pairs. One of the most basic is the network size. So when we say size, we can be referring to the number of people who comprise a bounded network, or we can be talking about more actor-centric details, like the number of people an actor knows or is related to or trusts or likes. We can also understand each actor's position within a bounded network. So one of the most common ways that we might do that is with their centrality or their nearness to the center of the network. And the center of the network isn't necessarily its actual physical center, but more sort of the importance of the role that they play in the network. So if you think back to the types of relationships that we talked about earlier, a gatekeeper would be quite central to a network, but an isolate who's more peripheral to the network or non-central wouldn't be in the center of what's going on. Centrality can be conceptualized in several different ways, including degree, which is the number of links an actor has with the other actors in the network. So having more links or ties indicates higher degree centrality, which indicates being a more central player for the network. We might look at betweenness centrality, which is the number of times an actor is a connector along a path between two other actors. And that can be a direct mutual acquaintance between two people who maybe otherwise wouldn't know one another, or as part of a I know a guy who knows a guy who knows a guy type of chain that connects two people. Actors who are more central to a network will have higher betweenness centrality values because they'll connect people more frequently than people who are on the network periphery. And then there's also closeness centrality. So we might be looking at the average distance from the actor to all the other people in the network. So this is really a measure of how easy it is for that actor to reach all the other people. Actors who are more central to a network will have an easier time reaching the rest of the network using shorter paths because they have more direct connections. If we're looking at an entire network, we might think about centrality in terms of the centralization or how hierarchical or flat the whole network structure is. Networks that are more centralized will be more hierarchical in nature. So they have really a small number of those gatekeepers who will serve as connectors between all the other network members. And then in addition to individual actor positions in the network, we may also want to know about the number of connections in the network overall. So how cohesive or connected overall is the network, or how many possible connections between actors exist. We may also want to know more about the nature of the ties between the people. Are they more reciprocal or unidirectional? How many three-person or triad connections exist that show that we're getting away from just those person-to-person dyadic connections? Or how many clumps or subgroups of actors are there in the network? And are those subgroups connected to one another, or are they isolated from one another? So these types of measures are really, we're deriving them in the context of what we're interested in knowing about. So the same network of people can be connected to one another in different ways, right? So if we think about the members of a particular organization, if we ask them where they go for something like health insurance or benefits information, the network would probably look pretty centralized. There are probably a handful of benefits coordinators or human resources experts that most people go to. But if we ask them who the coworkers' friends are or who they like to eat lunch with, they may or may not name people from HR. So it's also more likely that with that sort of lunch-based or friend-based question, you're going to see cliques or subgroups emerge within the organizational structure. Things may also look more flat because it's unlikely that everyone's eating lunch with the same person or just a couple of people, especially when we're talking about large organizations. So because social networks are comprised of the connections between shared or the connections that are shared between complex living actors, the measures are really dynamic and can change over time. So people who are central to a network at time A may no longer be gatekeepers a few years, months, or even weeks later. And hierarchical networks can become flat over time or vice versa. And bidirectional relationships can become unidirectional. Connections can be broken so that two people are no longer interacting with one another for any host of reasons, or new connections can form between previously unconnected actors in the network. And those nuances are really what makes social network science interesting, because we can overlay different types of connections to understand if we have general gatekeepers or topic-specific gatekeepers in the organization, and we can also then look to see how things are changing over time. So investigations into network structures, whether conducted at a single time point or over time, really can look at the whole network, or they can be personal network focused. In whole network studies, we collect data from all the actors in the network, so we're asking everyone the same questions or making the same observations about everyone. These types of studies can give us more complete information about the entire network and give us a little bit more flexibility in what we can do with the data. So some of the network measures that we've talked about, like centrality, would be best investigated through a whole network approach. But whole network studies have their limitations in their difficulty. They can be costly because it takes time and effort to track down everyone and collect data from everyone in the network. And there can be serious issues with data quality and network representativeness if you fail to locate specific actors or if actors refuse to participate. Personal network studies are really looking at things at a local level. So this is closer to a traditional research approach, so you don't have to collect data from every member of the network. Instead, you have a set of participants who are called your egos, and they answer questions about their own personal network ties. So the people that they talk about are then called their alters. So the alters that each ego names may or may not be participants in your research. So if you're doing research on CDC employees and I name my family members who don't work for CDC as my alters, then they're outside of your respondent network, and that's fine in that person level design. Questions on a person network survey might have a lead-in that looks something like what we see on the general social survey when social network modules have been conducted. And say something like, from time to time, most people discuss important matters with other people. Looking back over the past 12 months, who are the people with whom you discuss matters that are important to you? So then your respondents or egos would name their personal connections. And then those people become that person's alters, and then the ego answers a series of follow-up questions about the relationship and communication patterns shared with each alter that they've named. Personal network studies don't have to be bounded to the same degree as whole network studies because those networks are naturally existing at that ego level. Their personal network studies are typically less costly to conduct and less difficult to conduct than whole network studies. And depending on the questions that you're asking, you can really extract rich, deep data about those ego alter pairs. But because you're looking at that personal level and not necessarily getting that whole network picture, you'll have some limitations on the network measures and conclusions you can derive. So both network designs are really valuable in their own ways, and which one is quote unquote right depends on the purpose of your efforts and what it is you want to achieve. So regardless of whether you're interested in studying whole or personal networks, the data collection approaches are pretty similar. Most studies collect and analyze primary data, so we have new data coming from study participants via some tool like a survey, an interview, or an observation, and we want to examine the ties or the relationships shared between the people. The questions used to gather the data can be closed or open-ended. Closed-ended network investigations require you to give a roster of all the network members of interest to your participants, and then the participants use that roster to answer a series of questions about interaction and connectedness with other members. So this approach can reduce the mental burden of recalling connections, but the workload can grow exponentially if the network is large because the roster is going to be really long. So if the research design requires participants to answer several questions about every single network member, it can take up to hours for participation. And then if you end up with a lot of missing data due to participant withdrawal, you can have issues around data quality. Open-ended investigations use that write-in approach and ask respondents to identify their own connections without any type of prompt. So this approach can reduce workload, especially when we place a cap on the number of connections we're asking our actors to describe. So for health studies, common caps tend to be 5 to 12 connections. And since you're asking your actors to think about their connections without any assistance, you run a higher risk of recall bias because without those prompts, people may forget or neglect to identify their salient connections within their own networks when they're answering your questions. So you can end up in situations where people name fewer connections than you are hoping that they will, or they may name the correct number of connections, but fail to choose or describe their most important connections in the context of your survey or interview questions. Secondary data sources or existing data sets can also be used for social network research. Using existing records or databases obviously is much easier than collecting new data, but this approach can also impose limitations on the relationships that you can analyze because you're going to be limited to the variables that exist in that data source. So whether you use open or closed-ended questions to collect new or primary data or use existing records to conduct a secondary analysis really depends on the purpose of your research. There's no right way to gather the data, but the data that you collect and use needs to be sufficient to answer your research questions. This is typically true in science. To facilitate those primary social network studies, researchers typically use some combination of 6 different data techniques. Surveying respondents is the most common. And when I say survey here, we're talking about the standard individual level type surveys that we see. These can be questions that you might see from your healthcare provider, or maybe your insurance company asks you questions about how often you see your primary care physician, or in a customer satisfaction survey, a restaurant might ask you who you were with the last time you visited the establishment. These are really rudimentary forms of social network data because we're not getting that deep data or deep information about your connections. Egocentric data is the one that we really use for those personal level network studies. These are questions that ask you to think of and describe the characteristics of people that you interact with or speak with. So it's kind of like survey network research plus. So in addition to standard questions, you're also getting that layer of complexity by asking people to talk about their social connections. Sequence data are sometimes called partial network data. And here you would interview or survey some or all of the people who are nominated by those egos who are participating in your survey. So it's more complex than straightforward egocentric data collection. So it's like personal network study plus. So you start off by asking the egos to describe their alters, and then you follow up with contact to some or all of those alters, and then also ask them to participate as egos. So this is really a respondent-driven approach to sampling, sometimes called snowball sampling because of the way the sample grows. And this can be a really cost-effective way of reaching hard-to-reach populations. When you conduct a census, you're interviewing or surveying all of the members in the population of interest. This will provide you with a complete map of the interaction network within your population of interest, and this is where rosters can be very helpful. Two-mode data or jointness or duality data is really what we use if we want to know if people were in the same place at the same time. And then we have that archival data for secondary data analyses where we're using existing data sources. So up to this point, we've gone over a lot of the nuts and bolts in terms of the concepts that really drive social network science. And you might be wondering when someone would choose to do this type of study or include these type of methods. Social network research really can add richness to data collected for a variety of studies. Researchers and evaluators may want to have social network data as part of their investigation when they want to know about disease exposure or transmission, when they want to see how information or ideas or practices and behaviors are diffusing through a network, to help with study recruiting, especially with those hard to reach populations, or in intervention studies, when we want to know who the key players are in a network to help us disseminate information or increase buy-in to programs, to know how many subgroups or cliques exist within our organization or network structure and what those cliques look like. When we want some more information on how to create leader, learner, or mentor-mentee pairs. And if we want to change characteristics in the network, like to increase connections where two people aren't connected to one another already, or to break ties that we feel may be unhealthy or contributing to unhealthy behaviors or attitudes. Or we may want to look at how members who are connected to one another within a network are similar to or different from one another. So in social network investigations, we can use those social network variables to either be our predictors or our outcomes. So we can look at social networks to understand social capital, or the extent to which our social connections act as resources that help make our life better, more enjoyable, easier, or more fulfilled. So from this perspective, social connectedness is kind of like a currency that we can use to improve our lives. So we may want to understand how social network attributes explain different outcomes that are health related. So here the social network variables would be predictors. Or we may want to understand what factors affect our capacity to build social currency reserves. So in this case, the social network variables would be outcomes. From a social homogeneity perspective, we may want to understand how and why people are similar to or different from one another within a network. We can use social network variables to investigate how people influence one another's behaviors or attitudes, or we can look at how similar or different actors are in the same network with respect to certain relevant characteristics or traits. A lot of the analysis that we do in social network research can be conducted in statistical packages like SPSS, R, SAS, and Stata, or even Excel. But there are also special software packages like UCINet that can help us calculate special whole network measures, like those measures of centrality, cohesion, density, and other things we've talked about so far. Those special packages also give us an opportunity to conduct sophisticated exploratory statistics, or we can calculate measures and then export them to data sets that we would use in our traditional packages to run descriptive or inferential models. And UCINet has this really neat add-on called NetDraw that allows us to visualize our social network data. So here's an example of what a network visualized might look like. So the connections between the actors are those little two-headed arrows, because this was a study of people who co-authored papers together. So the direction was inherently bidirectional for the relationships. But I really like this example because it also shows how you can overlay actor attributes to get more details about the network. So here you can see people are represented by different shapes and colors based on how many papers they had written. So you can start to see how people with different attributes are connected to one another. And I understand that this co-authorship network may not necessarily be interesting to you topically speaking, but I think it does give a nice visual of how you can think about ways that you can overlay worker characteristics to study issues that are relevant to employment, for things like workers with chronic or acute illnesses. But as with all research designs, there are some errors to keep in mind if you're interested in working in the social network domain. Social network data quality and study findings can be adversely impacted by errors of omission, where we forget to include certain actors or ties that are relevant to the network. We can also have errors of commission, which occur when we erroneously include actors or ties in the network. We can have errors of attribution if we incorrectly assign behaviors or traits to the actors. We can have issues around data collection with things like recall bias if people can't accurately remember information in order to answer the network-based questions that you want to ask them. And then we also have an implicit ego bias, which occurs because people are inherently different in how well they can remember or report their relationships with other people in their networks. So as a general rule of thumb, people who are more central to a network tend to more accurately report or describe their relationships with other network members, whereas people on the periphery tend to be less accurate. So now I just want to go through a couple of examples from the published literature. I've highlighted in this table a couple of examples of published social network research studies, and you can see that the studies cover a variety of topics and use social network data for different purposes. So some of the investigations are for certain health conditions like obesity and depression, and how they quote unquote spread through a network of people, which is really interesting because usually they're thought of as non-communicable diseases. Other studies look at workplace dynamics or relationship functionality. And still others look to identify key players who can help to establish new connections within a network or improve the flow of information between people. In most of the studies, the social network constructs are the predictors or independent variables, but there are some examples in here of how social network constructs can be used as outcomes of interest. So if you have the time, I think that these are a great starting place to look at how social network studies are conducted and how their findings are reported in the literature. And now we'll move on to a couple of examples that I have of in-process projects. So in 2017, I started a collaboration with Dr. Rosemary Ward from Miami University in Oxford, Ohio, to explore how the composition of a co-author network in a flagship journal in my field of occupational health psychology affects scientific impact at the researcher level, so for individual level work. We started with a model from a published study and used that as our guide. And again, I know because this is co-authorship, these may not topically have a direct connection to the work that you're doing. I really like to use this as an example of how you can start with an existing theory or model or idea, and then use social network methods to not only validate that model, but also show how networks can change over time. So using UCINet, we are able to show how the co-author network within that flagship journal grows and evolves over time. So we demarcated publications by editorships just because that was a logical way to break up the timeline. So during this first editorship, you can see we have these little pockets of the blue dots, and each blue dot is a co-author who contributed to an article in the journal. So these little connections of 2, 3, 4 individuals are co-authors on a paper. And then to the left, we have that vertical line of individual contributors, so single author papers. By the end of the second editor term, when we've added in data, now we're looking at about 9 years, you'll see the network has definitely increased in size and density. We still have some pockets of connected authors, which represent those individual papers, but we're starting to see that those co-author cliques are being bridged by people who have contributed to multiple articles with different co-author groups. And the network continues to grow and increase in density over time. And we start to see that we have this one like interconnected cluster off to the right of co-authors, and then more dispersion in the rest of the group. And this crescent shape that you're starting to see for the more dispersed portion of the network is really kind of arbitrary. So NetDraw does its best to try to make your visuals as clean and pretty as possible, and sometimes that means shaping them in ways that don't necessarily have a meaning other than to help make things clear. But we can see, again, that that relatively large cluster or clique to the right continues to grow, and it's becoming clearer and more distinct from the rest of the network over time, until by the end of the 20-year period on which we were focused, this was what we had as our visual depiction of the network. So we were able to export measures of centrality that we calculated using UCINet into our statistical package and then add them to our models. And we're refining some things and trying to overlay some attributes to see if we can get some more information about why we're seeing this split in the network. And we hope to have that paper published or in the pipeline for publication later this year or early next year. And then I also want to share with you a quick example of a personal or ego level network research project. So earlier this year, I partnered with Dr. Brittany Rosine from the University of Cincinnati to explore the association between college students' employment characteristics and their social support network composition. So we were conducting a secondary analysis on data that were collected from a small sample of college students as part of a study of human papillomavirus or HPV vaccine uptake. So we pulled out the employment questions that were asked of each participating student and also the social network questions that they answered initially to look at how their social relationships affects HPV vaccine uptake, to look then at social support network trends for working students. So here's an example of how our social network questions were structured. We based these on the structure of questions that have been asked in the general social survey in previous administrations. And then additional questions in the traditional fashion were asked about employment for each respondent. And I don't want to report all of our findings because we're currently in the process of preparing that manuscript for publication, but I did want to share some examples of the types of concepts that we were able to investigate through our secondary analysis. So because we had that traditional data, we could look at individual level characteristics to understand what proportion of college students were working, and also look at how their personal traits are potential predictors of the number of hours that they're working. But then we were able to take things a step further and look for relationships between how their social support networks are composed and what their employment status is. So in our analyses, we're able to describe similarities between our survey respondents or our egos and their alters based on both personal demographics and employment characteristics. We're able to approximate the connectedness or cohesion of the working student social support networks. We're able to identify how much support is supplied within a network based on the type of relationship between the ego and the alter, so whether they're family, significant others, coworkers, or friends. We're able to investigate personal and employment factors that significantly affect how close the egos feel to their network ties as well. And I do want to point out that we were able to do all of this without any special social network software. So we were able to restructure that initial HPV study data set and then analyze everything within the traditional package that we would use for statistics. So it didn't require anything additional. So I just want to end the lecture portion of today with some main points that I hope that you'll take away. Social network data really can be used to gain valuable insights about interpersonal connectedness for a group of people or sample of interest. We can use social network methods in conjunction with other traditional approaches of individual level studies or evaluations to gain a better understanding of both the between and within person factors that affect health-related behaviors and attitudes. Social network studies have a place in research that looks at a variety of work-related topics, which can include, but is definitely not limited to, organizational dynamics, information exchange, behavior change, health-related conditions and exposures to things like communicable diseases, and also psychosocial factors for the work environment. The scientific social network space really has some great published examples, and we highlighted a couple of those, but it's far from saturated. So there's a lot of room for creativity and practice. And so I'll close out the lecture portion of the webinar today by sharing a list of the references that I used to compile this presentation. And I've highlighted 2 references that I think are particularly useful for anyone who has an interest in social network science or would like to learn more about social network approaches to research or evaluation. So on this slide, it's the Borgatti, Everett, and Johnson book, Analyzing Social Networks. And here is Tom Valenti's book, Social Networks and Health. Finally, I'd be remiss if I didn't acknowledge the 2 co-authors of the studies that I provided as my own personal examples. Dr. Brittany Rosine and Dr. Rosemary Ward have both been tremendous mentors as I've been learning to navigate the world of social network research. And so I'm excited to have some social network publications co-authored with them and available in the peer-reviewed literature in the near future. So with that, I will thank WWDPI for having me today and giving me an opportunity to tell you more about social network science, and I'd be happy to entertain audience questions at this time.
Thanks, Jessica. To our audience, if you have any questions for Jessica at this time, please enter them into the question box on the GoToWebinar panel, and we'll ask them out loud. Some questions that came in, and this came in earlier, so maybe we can put it on the slide, but are you aware of any social network data analysis that have been done to evaluate workplace health? And I know you had that slide with a list.
Yeah, so there are opportunities to look at work-related factors and social network health. Actually, one that's coming up, and this is going to be more sort of a national level investigation. I've heard that one of the modules on the General Social Survey for 2018 is going to be social network based. And then 2018 is also an administration of NIOSH's Quality of Work Life or QWL study. So that's going to open up doors to look at some of the basic health questions that would be asked, and then we'll have some workplace factors and then also those social network factors. So I think that's going to be a really neat and exciting opportunity to look at national level data, to look at how social networks influence health. In terms of published literature looking at specific organizations, I don't have any good examples right offhand. I think one of the tricky things about trying to publish organization level studies like this is that there can be questions about confidentiality or anonymity of the organization. So I think a lot of those things tend to stay in-house, or we may be able to find them in the business literature.
Mm-hmm. Okay. Another question, when do you expect your findings to be published, your research?
Sure, for the social network studies that I'm working on, that's a great question. Hopefully sooner rather than later. But as was mentioned in the introduction, so I'm a doc candidate at UC. My dissertation defense is in about like 11 days. So that's really been consuming my life. And once that's cleared and approved, then I'm going to turn my attention back to these 2 studies. So I'm really hoping to have the write-ups done in the next 4 to 6 months and then get them in the publishing pipeline.
Great. We'll look forward to those. I think that's all the questions for now. Jessica, is there anything you'd like to add following your presentation?
Just really that encouragement. I mean, I know it can seem like a lot. This may have seemed like a very technical webinar, but the fundamentals of social network science are really so logical when you start to get into it. And I really love the Steve Borgatti book and the Tom Valenti book as introductions to this this approach to collecting data. And I think that there are a lot of opportunities to maybe not necessarily conduct these full-fledged social network studies, but to add some elements of social network science into things like not only research projects, but also evaluation studies, or if we're interested in sort of gauging, our organization for opportunities for intervention, if we understand how people connect with one another and who those key players might be and who those gatekeepers might be, I think that we can really facilitate more effective intervention strategies.
Yes, good conclusion. Well, thank you so much for sharing your presentation with us and joining us today.
Great, thank you.